Physical Therapy for Ankle Sprain PDF. What is an ankle sprain? Ankle sprains occur when the foot twists, rolls or turns beyond its normal range of motion. An ankle sprain can happen if the foot is planted unevenly on a surface. This places the ankle in an abnormal position, causing the ligaments to stretch beyond normal range. Most ankle sprains occur when a weight-bearing foot makes a quick shifting movement, such as when you are playing sports or land incorrectly on an uneven surface. Symptoms of an ankle sprain. Most of the time pain, swelling and bruising occurs immediately at the site of the sprain. The ankle area will also be tender to the touch and will hurt when moved. In more severe sprains, a popping or snapping noise may be heard. Initially, the pain will be more extreme and will result in the inability to put weight, pressure on the affected joint. Treatment of an ankle sprain. Rest, ice, compression and elevation. Rice is the most effective way to treat initial symptoms of an ankle sprain. Rice is recommended 24 to 48 hours after a sprain. A physician or physical therapist can decide if crutches are also needed to protect the ankle while it is healing. The goal of a physical therapist is to get patients back to daily activities. Without proper rehabilitation, continued problems such as loss of function, decreased movement, chronic pain, swelling and joint instability could arise. Your physical therapist will select from the following treatments: range of motion and/or muscle strengthening exercises, body awareness and balance training, specialized training exercises to help muscles learn to respond to the changes in the environment, such as uneven or unstable surfaces, functional training, progression in treatment to include daily living activities that were being performed prior to the injury, activity-specific training tailored to occupation and/or daily activities, i.e. sports, modalities to treat the pain and swelling, manual therapy to regain normal joint mobility. The ankle sprain that doesn't heal. 25% of all musculoskeletal injuries are ankle sprains. What does spraining the ankle actually mean? The ankle joint is made up of 3 bones, the tibia, fibula and talus. These bones are held into proper position by a number of ligaments. The soft tissues surrounding the joint help stabilize the bones so they do not move too much in the wrong directions. Sprains usually occur during athletic activities, but sometimes we step down or trip on a rug and put abnormal pressures on our ankle. Most often, a sprain occurs when the foot gets tilted inward or inverted. These abnormal forces causes stretching or tears to the ligaments that stabilize the joint. The injured ligaments will lead to swelling, inflammation, and pain. If the injury is severe, there may be a fracture present. It is standard for doctors to order x-rays and do multiple different maneuvers to the foot and ankle to assess which ligaments are damaged and if any of the bones are broken. When no bones are involved, rest, ice, compression, elevation, and anti-inflammatory medication usually does the trick. When a fracture occurs, there may be need for surgical intervention. Many people recover from ankle sprains with no problems, but about 10% of ankle sprains do not improve with traditional therapy. In these patients, the ankle sprain was only part of the problem. Below the ankle is another joint between the talus and the calcaneus called the subtalar joint. Thus, the talus bone is connected to both the ankle and the subtalar joint. You can imagine that if abnormal forces are put on the talus, there will sometimes be damage to the ankle joint and the subtalar joint. Just as ligaments are torn or damaged at the ankle joint, ligaments can be damaged at the subtalar joint. Unfortunately, it is nearly impossible to tell the difference between ankle instability and subtalar joint instability by physical evaluation. To evaluate the damage, radiographs have to be carefully evaluated and some non-traditional Evaluations should be utilized. Placing the foot in specific forced positions is necessary to open up the joint spaces to assess the damage. These can be very painful, and a local anesthetic may be necessary in order to complete the exam. Ultrasound has shown to be a great way to evaluate injuries, but not all medical care centers have this modality available. If this injury is caught early, the treatment is mostly non-surgical. Different immobilization devices and physical therapy can usually strengthen the ligaments. Occasionally, the injury will become a chronic problem that requires surgery. Since this injury is hard to assess and difficult to differentiate from ankle joint injuries, your doctor may have a difficult time recognizing the issue. It is important to communicate your symptoms and pain as thorough as possible. Knowing how the injury occurred and the position your foot was in when the injury occurred can be very useful information for your doctor to determine what ligaments were injured. If you had an ankle sprain that doesn't seem to be getting better, it may be an unstable subtalar joint that is the root of your problems.